where I will give you a little bit information about the dental suture materials. Although you will be using like 3 or 4 suture materials mostly in your practice, but at least you should be knowing that what kind of suture materials are available in the market, and whatever you are using, why you are using them. Just do not use them just because I am saying it or anybody else is saying it, or maybe your seniors are using it. You should know, if you are using certain materials, then what is the reason behind it. And you should definitely have little bit of the suture, knowledge about what kind of suture materials are available in the market. So I will not give you too much theory. Obviously this presentation will be with you only. You can refer to it anytime that you want, but I'll give you a very brief introduction about each and every suture material. What are their properties, and what are they, where are they used, and how does it look like, so that whenever you go to market or go to the vendors to purchase the suture material, you should know what to look for, how they look, what are the different numbers, and what is the meaning of the different markings that are there on the suture material. So everything we are going to learn about suture material which are presently available in the market. So let's jump onto this presentation. This is slightly theoretical. If you want to jump, you can, but I would suggest you at least go through it once. So first of all, when we discuss the classification, so classification was natural, synthetic, and metallic. So in the category of the natural, we are talking about the catcut suture here. So it is a natural suture. Obviously, if it is a natural, it is absorbable. There is no doubt about it. This cannot be non-absorbable because this is natural and it is kind of a protein. So it is absorbable suture, and it is monofilament suture. Okay, so this is the origin: sheep intestinal submucosa or bovine interstitial serosa, and it is coming from the word called kit string or kit cut. As I have told you in the previous video, that all the all the natural suture material, they are being absorbed by proteolytic degradation. Means, since it is a protein, so anything which is protein, it will be absorbed by proteolytic enzymes. Body will behave that this is a foreign body, and body generates an immune response against these sutures, and body will try to eat them up. So this is how a suture material gets resorbed. Natural suture material in proteolytically. Okay, so let me put my own face a little down. Okay, I cannot do it more than this. Okay, so now you are able to see proteolytic degradation and phagocytosis. I can keep myself a little bit here. Which is, now this is an example of the catcut suture. In the market, this comes in the form of the plain catcut. So you can say, see, the name is absorbable plain catcut. So this is how these sutures look like. The companies may be different, but mostly these are yellow colored sutures. In oral cavity, we do not use that much. I have used these sutures a lot, plain catcut as well as chromic cut. But in oral cavity, usually you do not use these catcut sutures. So next is the chromic gut. It is again, it's a variation of catcut, where it is treated with chromium salts. To increase the tensile strength and decrease the resorption. Why do we want to decrease the desorption? Because mostly chromic gut is used into the internal layers for the stitching of the muscles, and if they get absorbed very early before the muscles even get their strength back, so that will lead to the opening of the wound or the dehiscence of the wound. So it is now treated with chromium salts to make it little more stronger, and it is also absorbable than monofilament suture. Rest these features are the same except for the chromic variation. And this is chromic gut suture. I will explain these terminologies later on. So chromic gut, this is how it looks like. It is brown in color. So when you open these packets of chromic gut, they are usually bathing in some kind of a liquid, and to preserve the catgut from the disintegration or the degradation. And when you open it, you wash it with normal saline. Do not use it directly. You wash it with normal saline. Now comes the most commonly used suture in the oral cavity, which is the silk, surgical silk. It is natural, it is non-absorbable because it is an braided suture. It's braided means something like this. This is how the braiding is. It's a multi-filament suture. It's the most popular suture in the oral cavity. We use this in India a lot because it is one of the very reasonable suture. The pricing factor is quite comfortable with most of the Indian population, and that is why maximum population uses this silk suture. Other advantages that I would say, apart from the inexpensive thing, is it doesn't irritate the adjacent mucosa, moderate tissue response, although it's natural. It is supposed to give increased response, but it gives moderate response, and excellent handling properties. I have used silk suture a lot, so I can say comfortably that excellent handling qualities, and then also it is inexpensive. And this is how the suture looks. Comes in a packing like this. These are the numbers that I will explain later in the coming presentations. So you can just read the other like blood vessels, nerves, tendons, etc. Basically and practically, this silk suture can be used anywhere in the oral cavity, anywhere in the body, and it is very popular for the intra-oral suturing. So next comes the nylon suture. So nylon, the trade names are, Surgilon, Duralon, Ethilon. So if somebody is asking you, okay, you want Ethilon, you know that they are talking about nylon suture. They are also used in oral cavity. This is the composition. These are polyamide sutures. These are synthetic, non-absorbable. These can be mono or multi filaments. Synthetic these are synthetic. These are polyamides. These are very popular suture material for skin. I have used nylon a lot while doing my oral surgery procedures. Extraoral suturing, I have used nylon a lot. So minimal tissue response is there. Very good tensile strength. I will talk about the disadvantages or the negative points also. Inexpensive. Yes, it is not a very costly suture. We used to treat a lot of poor patients and nylon was my preferred suture for the extraoral suturing. Disadvantages, yes. So because it's very stiff suture, okay, and larger knots are required, and secondly it has the tendency, because it is very sharp suture, means needle is sharp, yes, but the thread itself is very, very sharp. Sometimes it tears through. So if this is the flap and suture, you are putting the suture through it, this thread itself is so sharp and so like thin, strong is there, and so stiff, it sometimes tears the tissue. And thirdly, this is the most irritating quality when it comes to oral cavity, that it possesses the memory. So multiple square knots are required. That means when I am suturing, I put one knot and this is not sufficient, I am putting another, this is not sufficient, third, and sometimes four. So whenever I am putting nylon sutures, I am giving at least 4 knots, or one surgeon's knot, which I will explain later on in the upcoming presentations. Surgeon knot plus 2 regular knots. Otherwise, when my patient comes back after surgery, the nylon sutures are open. Yes, they do get open. So this is how the nylon suture looks like. I'm going to explain all these features. You can see these are monofilament polyamide. So nylon was polyamide, synthetic. Here the picture is monofilament. Mostly monofilaments are used. Now the proline. Proline is also synthetic, non-absorbable and monofilament. The material is polypropylene. It is a very commonly used suture. I have used 4050 proline a lot for my extraoral skin closures, closure over this area. When I used to do when I do lot of fracture cases, and after the hair, if there is any laceration, proline is suture material of choice, and it is blue colored. You can easily identify the proline suture, and they have very good tensile strength, and they are very extensively used in plastic surgery. So in the nutshell, plastic surgery and blue colored sutures are there, and these are excellent handling properties. Between nylon and proline, I will always prefer proline, and their knot tying ability is very nice, and they do not get untied, and the handling is beautiful, color is beautiful, and strength is beautiful. So I anyway prefer proline for my extraoral suturing as compared to the nylon. So this is how a proline suture looks like. This is a beautiful royal blue color here, and it is monofilament suture and proline suture. As I have already told you, they are very good at handling, knotting and biocompatibility. So there is one distinct advantage of the proline. Sorry for the mispronunciation. So when swelling happens, proline will stretch to accommodate the wound. So there will be little cutting through the tissues, and when swelling recedes, suture will remain loose and keep the edges properly approximately. What does it mean? Suppose there is a swelling here, and I have put sutures, and after surgery swelling increased. Now in normal scenarios, there will be tension here. These sutures will get tense, right? There will be tightening of sutures. But what will happen? The proline material will stretch itself like, I would not say exactly rubber band, but slightly stretch itself to accommodate the swelling, and it will not stretch. Suppose if some other suture material is there, and this is the tissue, and this is the suture material, and this tissue is now swelling. So these suture materials, now they can cut through the tissues and come out of the tissues, but this will not happen with the proline. So as the swelling recedes, it will remain loose and still the edges are approximated. So this is the beauty of the Proline. Any case, for the skin closures, prefer Proline. It's a costly suture, there is no denying about it, but the kind of closure that it gives is beautiful. So suppose if a patient is coming to you with a laceration on their lip and intraoral laceration also, so on the lip side, on the chin side, you can give Proline, and on the inside of the mouth you can give Vicryl, so which we will discuss in the coming slides, and what is Vicryl. So let's jump on to the next. So polyglycolic acid. So for this I am going to stop the video and I am putting this slide into the next video. So video is already 15 minutes long, so I would like to keep videos as short as possible so that you can digest one video at a time. So let's go to the next video where I will cover all these rest of the suture.